Hello, everyone. Happy to see such a nice group here today. I hope everyone got their sandwiches and have lunch. Would everybody please stand for the Pledge of Allegiance?
Ready? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. And now we're going to remain standing and say for a moment of silence and say a prayer for our first responders and any service members and any unwell members of our community. Thank you.
Good to see everyone. Please enjoy your lunch. As you know, our hospital...
Speak up, Jenny.
Can't hear you. Speak up.
Make it closer.
I am. I can't get any closer. Am I okay, Tom?
Better.
Okay. I just wanted to welcome you here and just remind you that your lunch is from our hospital, and please enjoy it. And we are going to ask Ed Lackerman. Don't leave. You want to go on now or you want to go on after? Thank you, Ed. Sorry about that.
No, that's okay. It's a vet call. So
Okay, thank you.
we had our puppy in for some testing. All right. Good afternoon, everyone. Thank you for coming down. I really don't have a ton for you today. I know last week we spoke about a bunch of things, but I want to wish everyone a very happy St. Patrick's Day and make sure that we're being very aware and safe on the holidays. We're responsible, but you got to be careful for the other people out there and the responsibility there. Town-wise, we have the projects going. I don't know the new openings. Everyone knows Five Below opened. We have a 50-plus personal training center that opened, and also an art studio, and that is right next to the building behind 7-Eleven. I call it the old Panavani building because they owned it, and in the same parking lot as a diner. They have a really nice European market in there as well. And we have Wipe Your Paws. So anyone with dog owners, any dog owners, they do grooming and they do daycare for your animals. So that's a recent opening as well, and we have a couple more coming up. The new Walgreens across town opened. Which anyone live over by the Grand Pond? How do you like the store and the? Yes, a lot more convenient as well. And I see Susan doing some knitting. So anyone into crafts and all, Michael's will be opening this month as well, right over here in the Yorktown Green. And those of you, I know you could tell I like my food. The old Miraggio's restaurant is going to be reopening. The same owner, Par, and that's at the Triangle Shopping Center, and they're going to be starting their $10 million renovation over there. Wow. Yeah, so some great things. I'll give you a little update because I was going to send Susan an email, but since she's sitting here anyway, at 12 o'clock today, I had a phone conference with Westchester County, our executive Ken Jenkins, who sends his best, especially to Rosemary, as he's worked with her in the past. And we were talking about the Halleck's Mills sewer extension and the East of Hudson funds, and he said that we should be able to get a resolution that was knocking around 3 or 4 years ago through the Board of Legislators, and that money can be used up front. So it's something that's very helpful when we do something. If a grant or money comes up front, we don't have to bond for it, which is a cost to the taxpayer. So that was very, very good news, and we spoke about maybe some possible ways of expanding upon that money. So we are working on that. It's a goal of mine before I leave office to at least have the framework in place to take the 600 plus houses in the Halleck's Mills sewer district that are on septic off of septic and into sewer. But it is quite a large price tag, so we're going to break it down into smaller bites and make sure that we could get something moving. Other than that, my mind is a little jumbled on all this because it's been a very busy couple of days. I'm trying to think if there's anything celebration-wise. We just had at the Senior Center. Did anyone here go to the Senior Center for St. Patrick's Day celebration? Oh, no, you weren't there, Kathleen. You should check out our nutrition center. They have some great celebrations there, company, just a lot of really good things for our seniors, and it's not just for people in need. You know, a lot of people are like, oh, I could feed myself. I don't need to go there. You pay for your lunch. It's not very expensive, but it's good. It's nutritious. But most important, I go there all the time, and there are people that sit there and they talk and they kibitz, as you say in Yiddish, and they have a great time. And you sometimes get some surprising entertainment because one of our residents was one of the original Belmonts.
No.
And Angelo was actually singing at the party. Paulie, who is one of our volunteer firemen in Mohegan Lake, who 995 calls he went on last year. Paulie DJs all of the parties for the senior center complimentary as a gift to them, and his lovely wife is with him. And he found some of the Belmont songs karaoke style without the lyrics, and Angelo was singing, and actually, hopefully no one has a tape, but I was singing with him. And they might take that as evidence and lock it up, but really some great things there. And I encourage anyone, when you're looking for things to do, we have our recreation guide. The new one is outside. My office is available. All of our council people know about events and things going on, so please avail of it and make sure that you that you knock on our door, and when you need something or have some questions, we're always here for you. That's
Thank you.
pretty much it.
Thank you.
Thank you all.
Thank you.
Thank you, Ed.
I just want to take a minute to apologize because I've neglected to introduce the board, and I'm sorry, but I saw Ed leaving, and I wanted to catch him before he left. So, you were on the phone. Okay. Yeah, I know, but I apologize for that. So if we can announce our...
Daryl Lindholm, Secretary.
Barbara Leifeld, member.
Rosemarie Paniel, Vice Chair.
Jenny Minton, Chair.
Deborah Marks, Liaison to Assemblyman Slater's office.
Joe Falcone, Parks and Recreation.
Thank you, everyone. Now, I would like Daryl to introduce our next speaker, please. Thank you.
March is Colon Cancer Awareness Month, and we're pleased to welcome Dr. Debbie Bakes to speak on this important subject. Dr. Bakes is the Columbia Doctors Colorectal Surgeon and Assistant Professor of Surgery, mouthful, at Columbia University Medical Center, affiliated with New York Presbyterian Hudson Valley Hospital and New York Presbyterian Columbia University Irving Medical Center. Dr. Bakes earned her degree from Tufts University School of Medicine, served her residency at Stanford Hospital and Columbia University College of Physicians and Surgeons, and completed her fellowship at the University of Miami's Jackson Memorial Hospital. Dr. Bakes has published and presented research on subjects such as the laparoscopic colon resections, pancreatic cancer, and recovery after colorectal surgery. Thank you for joining us.
Thank you for having me. As she said, March is Colorectal Cancer Awareness Month, so I'm honored to have the opportunity to talk to you about this subject. So we'll briefly talk about some of the facts, some of the numbers about colorectal cancer, the importance of early detection, and most importantly, how to improve colon health through our nutrition. So this year, unfortunately, approximately 140,000 people will be diagnosed with colorectal cancer.
Phew.
Yeah, and looking at the numbers, it's actually estimated to be up to 150,000 by 2026. So it's just staggering amounts of people get diagnosed with colorectal cancer per year. Of this, unfortunately, over 50,000 or 56,000 people do die from this disease. but it is a very highly preventable and treatable disease if it is caught early. There's an estimated 40,000 or more lives that could be saved through screening and early treatment, which we will talk about in this slide. So here are some of the numbers. So colorectal cancer is the second leading cause of cancer deaths. It follows lung cancer as having the most causes of death from a cancer. It is the third most common cancer in both men and women, with prostate being the most common cancer for men and breast cancer being the most common in female, then followed by lung and then colorectal cancer. Here are some more numbers. 1 in 20 Americans will be diagnosed with colon cancer in their lifetime. That means that each of us has a lifetime risk of approximately 5%. 1 in 10 of our colon cancer patients will be diagnosed before age 50, which obviously, is a remarkable, unfortunate statistic that I'm, sharing you with. The death of, Black Panther actor in 2020, Mr. Chadwick Boseman, and last year, actor James Van Der Beek at age 47. These people have brought national attention to the rise in colorectal cancers for those under 50 years old. And even though the rate of colorectal cancer has actually gone down in the last few years, the cases amongst patients less than 50 are actually rising by 1 to 2% per year. Colon cancer affects men and women equally. Colorectal cancer affects all races and ethnicities equally. And even though, that is the case, when one looks at the raw data, African Americans and Hispanics are more likely to be diagnosed with colorectal cancer in the advanced stages. But 90% have a 5-year survival rate if found in the earliest stages. So this is where we want to diagnose most of our patients. Now, what are the risk factors? Obviously, age. As one ages, the risk of polyps increases, especially over the age of 50. A family history of polyps or colon cancer, obesity, smoking, a diet that's high in fat, a diet that's low in fiber, alcohol consumption. And then I have in my presentation a few of these myths versus reality slides to kind of hone in on some of the important facts here. So myth, only people with a family history of colon cancer get it. That's obviously a myth. The reality is that 75% of all of our new cases actually occur in individuals with no known risk factors, other than the fact that they're older than 50. A family history just means that you have to start your screening earlier or do it more frequently, and I'll go over that later. Now, what are some of the symptoms of colorectal cancer? An obvious one is a change in bowel habits. So, for example, if you were normal and then all of a sudden you're being constipated, or you have loose stools, that's one of the risk factors, or a symptom, I should say. A change in the color or the shape of the stool, rectal bleeding, or blood in stool, or in the toilet after having a bowel movement. And again, these can also mimic things like, hemorrhoids. But, if it's continuous bleeding, we've treated the hemorrhoids, then we start getting worried about something like colon cancer. Stomach discomfort or cramping, fatigue or weakness, unexplained weight loss, anemia, or also feeling bloated. And what is the screening out there? Obviously, how does colon cancer start? That's really the question here. Colon cancer usually starts as benign polyps. Polyps are growths on the lining of the colon. Here's a little picture of representation of what a polyp can look like for us. Most polyps often produce no symptoms at all, but they may become cancerous over time. Another myth versus reality. Having a polyp means I have cancer and I need surgery. Well, not necessarily. A polyp is a precancerous lesion that could progress to colon cancer. That's why if we detect these polyps and we remove them before it becomes colon cancer, then obviously we can prevent, the cancer. Yes.
While we're on polyps,
Yeah.
how big are they?
So the polyps can range. When we do colonoscopies, they can be as small as a few millimeters when we catch them early, and then obviously as we, as they progress, they can be a few, a sub-centimeter or even a few centimeters as they grow. And no one knows how fast they grow. That's kind of, that's where the individual DNA is. Yeah. Yeah. And like we said, most of the benign polyps are found during colonoscopy and they're removed at the time of the colonoscopy. If there's a polyp that's a bit larger, we sometimes have to refer, to a special endoscopist or a special GI doctor that will remove the larger polyps. But that being said, sometimes we do find cancer within a polyp, and then you may need surgery to remove that part of the colon even before that polyp becomes cancerous, like a mass. So back to screening. When should we start screening? And when we talk about screening, we're talking about these colonoscopies. The American Cancer Society recommends that those with an average risk and no family history should begin at age 45. Now, this is a change. It used to be 50. So in the last few years, 2018 to be exact, the recommendations went down to age 45 because we are seeing younger and younger patients get colon cancer. And a family history means that screening should start 10 years before a loved one was diagnosed with or a polyp was found. So, for example, if someone is 52 years old and gets colon cancer, 10 years prior to that, their child or their sibling should start their colonoscopy at age 42. If someone is 62, 10 years is 52, they still get the colonoscopy at age 45. So it's either age 45 or if it's before that 10-year mark for a patient with a young diagnosis of colon cancer. So some of the tips of colonoscopy, the hardest thing is just getting scheduled. That means seeing myself as a colorectal surgeon or seeing any gastroenterologist. Those are the doctors, the stomach doctors that do endoscopy and also colonoscopies. Then the prep. The prep is obviously the worst part of the colonoscopy, but it's very, very important to take the prep as instructed and have a clean colon, because as the pictures show, the poor prep on the left, you're not able to see those small polyps, especially if those small polyps are 2-3 millimeters. But versus if you have a nice prep, as on the right, obviously a lot easier to find those polyps. Sometimes, if a colonoscopy does have a poor prep, we don't continue with it, and we actually have you come back for a repeat colonoscopy, depending on how poor the prep is. So obviously we want to avoid that. And then some little, comic things here about, colonoscopies that, are in the media, especially during March as our Colorectal Awareness Month. These kind of pop up. All right, and on to another myth versus reality. A colonoscopy is a difficult procedure to undergo. Well, it's not painful at all, so it's not difficult whatsoever. Like I mentioned, it's a day procedure. We do have you sedated during the procedure to minimize any discomfort, and the discomfort really comes from the air that we use to inflate the colon so we can see the colon during the colonoscopy. And like I mentioned, it's really the feared part of the procedure comes from the prep, which is the day before. So there's various other screening options. Obviously a colonoscopy is the gold standard for diagnosing colon cancer, but there's other, stool-based tests that look for signs of colon cancer in a person's stool. Amongst those are the FIT test, or the fecal immunochemical test, or the FOBT, or fecal occult blood testing. And these check a stool sample for invisible amounts of blood from a polyp or a cancer. And these tests can be repeated every year. It's mostly your primary care doctor that will order these tests. The other, newer exam is the Cologuard, which maybe some of you have done or have heard about. This is a less invasive home testing, which looks at the presence of DNA in a stool sample. You essentially get a bucket, you put your stool in the bucket, you send it out, and then the lab looks for any DNA. Obviously, if any of these result in a positive result, you do have to get your colonoscopy. And there is something called a virtual colonoscope that can be done every 5 years. Only some hospitals perform this. It's a CAT scan-based colonoscopy. For example, Hudson Valley does not do this. Our nearest hospital, at least from the ones that we're affiliated with, is down at Columbia. They can do a virtual colonoscopy. Mostly done for patients that are, unable to undergo a colonoscopy. So it's another option out there. And that's what it looks like. All right, so we kind of talked about this already, just a little screen that talks about, if you're older than 45, you get your colonoscopy done. And then these are the survival rates. So as we mentioned, if we catch colon cancer early, so for example, stage 1, it's a very, very good survival rate, 94%, versus if we catch it later on, stage 4, for example, is when we have metastatic disease. That means that the colon cancer has spread. We're looking at obviously a much lower survival rate in the teens. How can we prevent colon cancer? We talked about the colonoscopy screenings where we remove the polyps. Know your family's cancer history, because that will tell us, how often one has to do a colonoscopy. Like we mentioned, eat a diet that's high in fiber, and I'll talk about some foods that are more fiber rich than others. Exercise, be aware of your body, listen to your body, know your symptoms. Stay up to date on your colon cancer screening. Your doctors can help you with that. And then the last part of my presentation talks about, which foods are high fiber. Unfortunately, the average American diet has a diet that's pretty low in fiber. So on an average basis, we only consume about 12 to 15 grams of fiber. Ideally, men should have upwards of 25 to 30 grams of fiber. Us females can get a little less, 20 to 25 grams of fiber. But that's a lot. And when we talk about fiber, there's 2 different types of fiber. And the nutrition label of all of our foods that we eat talks about the dietary fiber. It hides under the carbohydrate section of the nutrition label, so you can see how much fiber you get in that piece of toast, for example. So amongst our fruits, apples have fiber. It's really the things that have the skin. That's where the fiber is. So an apple with the skin gives you 4 grams of fiber. A pear gives you upwards of 5. Raspberries, a good cup of berries, gives you about 8 grams of fiber. Banana, a little less so, at 3 grams of fiber. Then in our next food group, grains have lots of fiber. A piece of whole wheat toast tends to have about 2 grams of fiber, but there are other, there's toast out there that, Fiber One makes one, for example, where they have higher percentage of fiber in them. So you can look for that in the supermarket and get, more out of that sandwich. And instead of having, 4 grams of fiber in that sandwich, you may be able to get like 8 grams. And then obviously anything, brown and grainy, so brown rice, brown bread, cereals tend to have a high fiber also. In your vegetables, believe it or not, salad does not have fiber. It's a roughage, it's good, it's healthy, it's good for the colon, but it doesn't provide fiber. It's the other green leafy vegetables that provide fiber. So that's, broccoli, Brussels sprouts, spinach, peas, beans, those kind of vegetables. And then last but not least, this is the food group that gives you the most fiber. It's just one of those food groups that not all of us eat every day, unfortunately. It's your beans and your peas. So 1 cup of those can give you upwards of 15 to 16 grams of fiber, which is, half your day's supply in one meal. So all of us should be eating, those beans more often. So just to kind of finish up, a little true or false here. Colorectal cancer is the second leading cancer killer. True or false? There we go. Both men and women get colorectal cancer equally.
True.
There we go. Colorectal cancer often starts with no symptoms. That's true. Yeah. And then screening helps prevent colorectal cancer. True. Yes, most importantly. All right. So that's all that I have. I do come from Columbia, but I mostly see patients at our Hudson Valley location. I'm located across the street from Hudson Valley Hospital in the medical office building there. So happy to see you if you need any colonoscopies or any diseases or from a colorectal surgeon. Happy to take any questions. Yes.
If you do Cologuard, do you have to also do a colonoscopy?
You don't. Only if the Cologuard is
Could you
positive.
repeat the question so
Yes.
they'll hear it on the TV, because we don't have a microphone. back
So she
there.
said, if someone does a Cologuard, and do you have to follow that with a colonoscopy? And the answer is no, not necessarily. If the Cologuard is negative, and you want to continue doing Cologuard, so recommendations to do it again in 3 years. If the Cologuard is positive, or any of those other stool-based tests that I mentioned, that will lead you to a colonoscopy. Yeah.
Question.
Yes.
When a polyp's in transition, how long does it stay in transition before it becomes cancerous?
That's a hard question. None of us really know the genetics. It really does depend on the genetics and the DNA of each individual. Some people are lucky and can have small, slow-growing polyps that, obviously don't cause much until we find them. Other times, someone can have a short time between colonoscopies and have 5, 6 polyps, within 2, 3 years. So it's hard to say, and it's hard to say how fast they grow. Yeah.
Thank you.
I'll take your question.
I don't know, excuse me, if this is going to help your effort, but what is the preparation why does it have to be so extreme? And would you describe the preparation for anybody who hasn't had a
Yeah, for sure. So all of us have there's different preparations out there, I should say. We at Columbia, we use a fairly simple one. It's Miralax. It's the good sized bottle of Miralax, and Miralax is it's a powder laxative, and we have you mix that entire bottle in 8 glasses of Gatorade. Or if you don't like Gatorade, any electrolyte flavored water, the thinking behind Gatorade is that it kind of gives you those electrolytes as you're, obviously having loose stools. And then 2 Dulcolax pills. So that's my prep. It starts the day before in the afternoon. That day you're on clear liquids, so meaning, coffee without cream. Obviously any type of juice, water, Jello is included as a clear liquid. So that's the prep the day before. Other, gastroenterologists, other offices out there do have other preps. There's some preps that are tablets, so you take multiple tablets to kind of, again, evacuate. Other preps are small little fizzy bottles. Soup preps and soup tabs are the more common preps out there also.
And don't leave home.
Oh, yeah, definitely being near a bathroom that day. In the afternoon into the evening.
For sure.
Yeah.
I have a question.
Yes.
Most of us go to a GP.
Mm-hmm.
Will they ask you about a colonoscopy, or will they prescribe a colonoscopy if you haven't? Even if you don't have symptoms.
They should. I mean, it is one of those preventive
Right.
things that each GP should ask about. For example, mammograms for us females.
Right.
Prostate cancer checks for the males. So colonoscopies is one of those. If not, definitely bring it up to your GP because they can then refer you to, again, either a gastroenterologist or a colorectal surgeon.
I just thought as part of preventive.
Yeah.
'Cause I
Are
don't think
there
I've
any-
ever been asked.
Are there any other questions out there? The
Yes.
Polyps are removed, are they all tested in the lab for cancer? How do they determine?
Yes, they all go to pathology. And then obviously the physicians get the results and we make the phone call afterwards to let you know if it's benign or whatnot. Yeah.
Okay, well, maybe that's it. So I would like to really thank you,
Thank you.
so
Thank
much.
you.
Thank you for having me.
As an added comment, I have to say, she saved my life. I didn't even know I had it. I had a, well, all of a sudden, she took care of me. I'm not going to even go into it any further. It happened so quickly, and I'm cancer-free.
Yay.
So I thank you so much.
You're welcome. Nice seeing you.
Okay, do we have Ms. Bliss?
Yep, you're here.
Oh, you're going to introduce.
Okay, I'm not going to get up at the podium. Michael, come on up. Michael and Mary are with Sound the Alarm. Deb and I were at a Livable Communities and saw their presentation and thought, well, we want to bring this to Yorktown. He'll explain exactly what it entails. Thank you, Michael.
So I promise my talk will be a little less invasive. Okay. But thank you very much. It's very, very important. And obviously we have a person here whose life she saved, so that's very important information. But what I'm going to talk about is also important. So
That's right.
that information can save your life. And the Red Cross is interested in trying to save your life through home fire safety. Okay? So again, my name is Michael Dwyer. I'm a volunteer with the Red Cross. My lovely wife, Mary, is here as well. We both are retired and volunteering. So thank you, Yorktown Seniors, for having us here today. The Red Cross started this program about 10 years ago. And the premise, again, it's called Sound the Alarm, and it offers free smoke detectors with installation to any resident in the United States with no restrictions or qualifications. So every person in this room could call and book an appointment with Mary, and if you get lucky, I may be the guy going to your house, and we will do a fire safety inspection for you, and then any place where you should have smoke detectors, we will install them for free.
Oh, wow, that's wonderful.
That's a pretty good deal.
It is.
Very good deal. Thank you.
So, again, the Red Cross wants Americans to be Red Cross ready. all homes to be safer from fires. So since this program started, the Red Cross has documented 2,246 lives saved. And they don't come up with that as a fluff number. They do a major research on this when an event occurs to confirm that this is actually something that saved somebody's life. So we've installed over 3 million alarms, made over 1 million homes safer, and through our home visits, we helped educate 3.1 million people on fire safety.
Wow.
So it's a two-person team that comes to your house. So I'm usually the guy carrying a bag and going up the ladder, but the other person's the educator. And both parts are equally important. Because I've gone to houses where I did an installation in a house in Scarsdale. I pulled up that house, I'm like, oh my God, what am I doing here? This person has like a $3 million house. They don't need free smoke detectors. And I was a little pissed off, actually, when I got there. I'm thinking, why am I doing this? When I left, I completely changed my attitude. So it was a young couple, very nice people. They had 2 young kids. The woman, obviously, she had the ability to pay for this. It wasn't the importance of a free smoke detector. She was clueless on fire safety. She didn't know where the smoke detectors were. She didn't know how to pause them with hush buttons. She didn't know about fire extinguishers. She had no escape plan. So when we left, she was in a much better situation. And fortunately, she was very appreciative.
That's great.
So, and I've done installations in Yonkers.
Hopefully this way.
Yeah, but again, we have places that you can donate money to the Red Cross, and hopefully, people do that. It's bad because people try to give me money when I'm there. Oh, whoa.
No, I don't want it.
No, so we don't do that. So again, just a little more on the Red Cross. Red Cross is a charity, okay? It's not owned by the government. It's funded completely by donations. So, and over 90% of the volunteers in the Red Cross in this area, 90% of the people with the Red Cross are volunteers, okay? So that's an amazing stat. And the Red Cross, again, does not care about your income, your immigration status, your religion, your age, your sex. All we need is your name, your phone number, and your address to sign you up for the program. The goal is to make living in the United States safer from fires. So, a couple things that will help you be safer in your home. We have a catchphrase called keeping an eye on what you fry. So most of home fires start in the kitchen.
Yeah.
Okay, it sort of makes sense. So I'll give you a little side story. So when I first volunteered with the Red Cross, I was with what they call the DAT, Disaster Action Team. And those are the people who at 3 o'clock in the morning go to your house and give you a blanket and give you a toothbrush and give you a debit card to have you stay in a hotel that night. So those people are amazing. That is a really hard job. But I started off doing that, and I got a call to go to a fire in Yonkers, and this was fresh. I mean, the fire department was still literally there. And as we're walking into the apartment building, I'm stepping on something that's very crunchy. It's all black, and it's very crunchy. I don't know what it is. We go in. It was a fire in a, I'm sorry, my phone's ringing off the hook. Stop calling me. We go up. It was a mother and an adult daughter and a dog. The mother was cooking in the kitchen. She must have gone to Costco or Sam's Club, and she had like a 40-gallon cooking oil container right next to the stove. So you know where this is going.
Yeah.
So fire, catches fire, this thing just goes up. So she got burnt. She got out. She ended up going to the hospital for a few days. The daughter got out. The dog didn't make it.
Oh.
And what I was stepping on when I went into that place was the windows. The fire was so intense, it turned all the windows black and blew them out onto the curb.
Oh, wow.
The fire department said, because they were literally still there, that's unusual, that fire was so hot that the eggs in the refrigerator cooked.
Oh my gosh.
In the refrigerator.
Oh, my gosh.
So, and that poor girl, that's all she had was what she was wearing. Okay, so we're going to talk about a go bag in a couple of minutes. So, this is something that we all should do, but you just never know. So, very careful in the kitchen, please. Space heaters. We're still cold out. Hopefully, we're getting to spring soon. But space heaters are not clothing dryers. Okay? Don't put anything on top of your space heater. I've seen this. This is crazy. And if you have a space heater and you tip it and it doesn't shut off, don't use it. The old space heaters, the cheap ones, were very, very dangerous. The new ones now, it's designed to be if it tips over, there's a shut-off thing on the bottom, and it will shut off automatically. So just be careful. Keep 3 feet distance from a space heater and anything else. Curtains, clothes, all that. Overused electrical. This is something also, another major cause of fires. Anybody ever see the movie National Lampoon Christmas Vacation or something with Chevy Chase? He has a scene where he's plugging like millions of Christmas lights into the same outlet. And he's got extension cords and all kinds of things, and like a stack full of things plugged into one. Don't do that. Okay, bad idea. I brought a couple of props here. I'll show you one of my little props. I went to a installation for somebody who lived in Bedford Hills. Very nice woman. She rented a top floor of a 3-family house. Unfortunately, the landlord, I won't say any bad words since apparently I'm being televised here, was not a good person, and he had really let the building run down. And she had ceiling lights in her apartment, none of which worked. And she had a ceiling light in the hallway, which didn't work.
Oh, geez.
She's on the 3rd floor, walking up the steps in the pitch black. Okay? So what she did was she got couple floor lamps, ran them around the apartment, and then ran one out the door in the hallway. Every time you open that door, back and forth over the electrical cord, back and forth, and it frays the insulation. If you get exposed copper like I'm holding here, that will cause a fire very easily. So don't put any electrical cables underneath the rugs. Don't put too many things in electrical outlets. Just be smart about it. Smoke alarms. So this is a big part of this program. We will give you new smoke alarms. I won't use the word give because one of the rules we have, and there are very few, is that we have to put them up. Okay? Because I've seen smoke detectors in someone's house like that. Guess what? That doesn't work. So you have to actually open it up, and it has to be installed, and it should be installed properly. But this is the one that we actually do. This is state-of-the-art. This has got a technology where it will false trigger less. Okay, so that's nice. Because one of the big complaints I always hear is, oh, it goes off all the time, and then people either take the battery out or take it down completely, and then they have nothing. Well, that's not a good idea either. Okay, so this is a good quality one. And the new law in New York State, and it's about a year old now, is you're supposed to have a smoke detector in every sleeping area. Now, I go to a lot of places, and the old rules were you have one in the hallway, and on each floor. Now, every single bedroom. I don't even use the word bedroom because I've been in Yonkers, and I installed one of these in a closet. Guy was renting a room from somebody, and he was sleeping in a closet. So, but most people don't have that. So, if that's your circumstance, take advantage of this. Okay? Carbon monoxide detectors, also something we should have. Okay? Carbon monoxide is a gas. You can't see it and you can't smell it, but it will kill you. Okay? So there are ones that are very easy. You don't necessarily have to install them because a lot of them come with electrical. You can just plug it into an outlet. But it is a good thing to have. Also, let's go back to smoke alarms for a second. So we talked about them. I went to another house, I don't remember where it was, but the woman said, oh, I have one here, I have one here, I have one there. I said, oh, have you checked them recently? What? I put it up. It lasts forever, right? Well, no. So the old ones, basically, you had to replace the battery every year. Okay, so I got on my ladder, went up and checked it. Dead. Went to the next one. No battery. Went to the next one. Dead. She had 3 smoke alarms. None of them worked. So I call that wall decorations. Okay? So if you have wall decorations, that's not going to help you if you have a fire. Okay? So let's take advantage of that and get that fixed for you. Another thing I'm big on now is fire extinguishers. So everyone should have one. Let's do a little poll. How many people here have a fire extinguisher? That's not bad.
I don't even
That's not
know.
bad. How many people know where it is? How many people have it in the kitchen? Ah!
No.
Okay, take it out of the kitchen.
Right.
Where was the number one source of fires?
Kitchen.
If you have a fire in your kitchen and
How
you
can you
can't
get to it?
totally get your fire extinguisher and you have a fire, that's not going to work. Okay, so take it, put it in the hallway outside of the kitchen. Go to
Thought of that.
someplace you can go and get it, and then go put out your fire. Here's another one. Back to the fire extinguisher. How many people have this little plastic thing on their fire extinguishers? Okay, and some other people may not know it, but you should go home and check it. They put these on there for storage. So when they ship it,
The handle.
the way to make it work is you have to pull the pin and squeeze it. This will prevent the pin from falling out. Unless you're Superman, you cannot break this. Okay, the only way to get this thing off is to cut it. So now, you listen to Michael Dwyer, you pulled your fire extinguisher out of the kitchen, you put it in the hallway, now you go and get it, and it's got this on it. Now you have to go running around the house looking for a pair of scissors. So go home, look at your fire extinguisher, see if it has one of these little plastic things on it, and cut it.
Could I just ask one? How
Sure
do
you
know,
can.
How do you know if it's still working?
It says it.
So it's a good question, and I'd say since I've seen fire extinguishers that are 50 years old now. Oh, by the way, fire extinguishers don't need company. I went to a house where the guy had 3 fire extinguishers next to each other. What are we doing? It doesn't make any sense. So, if you're going to have more than one, and sometimes that's a good idea, put them at different spots of the house. So, back to your question. All the new ones have a little dial on them. And it's red is bad, green is good.
Right.
So if it's in the green, relatively sure that it's still good. Yes.
Do they refill them anymore? Mine needs to be
That's
refilled.
a good question. So
I can't
there are
find
certain-
anything.
There are certain brands, and First Alert does sell one, that are rechargeable.
Oh.
Here's the problem. Now you got to find a place that actually does that. And economically, doesn't make sense.
Yeah, I can't.
But you can buy a good one, and
Okay.
I have the information here. Consumers Report, Kitty or First Alert, $25. Okay,
Okay.
to take it and recharge it, I don't know how much it costs, but it's got to cost.
Can't find one here that does it.
Yeah, and there are very few places that do it. So, you also want to get one that's ABC. Okay, there's 3 types of fires. And, if you want to know each one, I'll tell you, but the point is, it should be able to put out ABC, and it will say it literally right on there. So the 3 types of fires, it's the same price. Some of the older ones didn't cover all types of fires. Back to one more thing on the fire extinguisher. So we use this term called PASS, P-A-S-S. And this is how you use the fire extinguisher. P, you pull the pin, like a hand grenade. You pull the pin on it. If you have this on it, you can't pull the pin. So cut this off. Okay. Pull the pin. It has a little point or it has a little short hose. Aim it. Squeeze the 2 triggers together and spray back and forth at the bottom of the fire. P-A-S-S. You you should have an idea, and certainly very important if you have other people living in a house with you, or children, or more likely in this environment with old people like me, grandchildren. You should have an idea of how to get out of your house if you have a fire. Okay? So we will help create a fire escape plan for you. If you live in a house and you happen to sleep on the second floor or even the third floor, how are you going to get out of there if there's a fire below you? You got to think about this. So, we can help you sort of map it out, and that leads to, do you need a fire escape ladder? And maybe. Don't do what I did, though. You learn these things, sometimes you learn things the hard way. My wife and I lived in Tarrytown for a long time. We loved it, great house. I bought a fire escape ladder. I actually tried it, threw it out the window. Everything was great. Put it under the bed, and then we moved. We moved to Pleasantville. And I took it with me. I put it under my new bed in there. And then I started doing this. After I retired, I started doing all this. And I drink my own Kool-Aid. So what I'm telling you, I've done myself. Okay? I'm a big believer in that. So I said, well, I'm talking about fire escape ladders to all these people, and that thing is really dusty. Let me see how this thing works. I take it out from under the bed, open the window, throw it out. It's 10 feet short.
Oh.
We're at a higher level in the house, and my wife looks at me and goes, are you crazy? So I went and bought a 3-story escape ladder. So just be conscious of what you're using there. So I talked earlier about this poor woman who lost everything in that fire in Yonkers. We talked about having a go bag. So a go bag is nothing more than a little gym bag or a backpack. And I have a list, and I think it's in your kits. Is it in the kits? Okay. Put some cash in there, put some ID in there. I always use this as an example. I carry a wallet. Make a copy of every single thing in here, or your credit cards, front and back, driver's license, registration of the car. You can get all of those things, but if you have it on a piece of paper, you can call the credit card companies. They'll get you a new credit card the next day, overnighted. And the phone number's on the credit card. So it just will make your life dramatically easier. Everybody has a cell phone. I don't know half the phone numbers of people anymore because they're all on the cell phone. If you don't have your cell phone, okay? So you might think about printing out the phone numbers and putting them on a piece of paper and putting them in your go bag. And then important documents. Medicine. How many people take a prescription medicine?
Everybody.
Yeah, we all do. Put 2 days' worth of medicine in a little container and put it in your bag. Because if you're out of your house, you may be ready to go back. Assuming the house didn't get destroyed or something, the fire department may say, I'm sorry, you can't go in. It's not safe yet. I did a shelter in Yonkers a long time ago. The 8th and 9th floor caught on fire. Nothing happened to the people on the first floor. They weren't allowed back in that building for a month. A month. So, you want to be able to get your medicine the next day. You can make an adjustment if you have a little bit of time, but the next day you'll have the medicine available. What else? Maybe even just a change of clothes, sweatpants and a shirt, and an extra phone charger. That's very important. Because, again, we all rely on our phones. If your charger's in the house and you're not, have a charger with you. You can keep your phone working. Okay. That's the go bag. What else do I got here?
Do you have copies of what you think should be in a go bag?
It's in the
It's actually
packet.
in your
Oh, it's in the packet? Okay.
Yeah, it's in that packet. So it's we created that. That worked out well. So lithium batteries. I don't think that's a major issue with this audience, but extremely dangerous in fires. Now, e-bikes, certain scooters, even some wheelchairs will have these big batteries, and you just have to be careful with charging the batteries. Don't charge them and then go out. And God forbid, don't buy any like off-brand extra battery for it, because those are so dangerous. The fire departments hate lithium batteries because it's a fire that burns so hot they can't even put it out. Serious, serious problem. When I do these talks, a lot of times people will say to me, this is back to the fire extinguisher thing, I heard about fire blankets. And, what about that idea? Does that work? So I have a great story. I had to bring it up just because I got a great story. So fire blanket versus fire extinguisher. So my wife and I, we like to go to a lot of national parks on vacation. So we like to do some hiking. So we went to Yellowstone National Park and decided to go for a short hike right before dinner. So it was very quiet. There was nobody on the trail. Just nice casual, don't expect to see anything, just go for a nice little hike, just get some fresh air. As we're coming around a corner on the trail, a big black bear is coming up the trail right towards us. Okay. The more I tell the story, the bigger that bear gets. But it was a big black bear. And then we stopped. We did all the right things you're supposed to do. Get tall, put your hands up, don't run, back up slowly. And as we're backing up, my wife backs up right into a tree. Now, you want to see a panicked face? Well, that's what happened. So we got scared, but the bear soon lost interest in us. He's coming up. He wasn't too hungry, or we didn't look threatening for sure. And he made a left turn and just left us alone. But that experience cost me $50.
Oh.
Because the next morning, my wife was not going out hiking until I went out and bought bear spray. Okay? Bear spray is nothing more than a big can of pepper spray, but it can shoot a good distance, 30, 40 feet. So hopefully it deters the bear before he gets too close. And I relate bear spray to the fire extinguisher. I prefer to keep a distance between the danger and me. And a fire blanket, you literally have to walk up, throw it over the fire. You are now right on top of the fire. I refer to my wife all the time in my stories, and my wife has a horrible story about this. So her mother, many, many, many years ago, actually didn't have a fire blanket, but she had a blanket. And she had a kitchen fire, and she threw the blanket over the fire. It came up underneath it to burst both of her arms underneath it. Okay? Or I would be 6 feet away with a fire extinguisher.
Yeah.
Keep your distance from the danger. Okay? Fire extinguisher versus fire blanket. Okay. That's my bear story. The Red Cross says that you have 2 minutes to get out of your house in a fire. So 2 minutes is not a lot of time to be running around looking for important documents, trying to find this and that. That's why we want to have the go bag. Mm-hmm. Get your go bag, get your phone, go out, then call 911. Okay? When you're safe, call 911. Don't be calling 911 while the house is burning down on top of you.
Interesting.
And get out, stay out. And part of that is if we have a fire escape plan, the husband goes out this way, the wife goes out that way, they don't know where each other is, they both go back in, bad things happen. Okay? So have a plan. We're both, God forbid something happens, we both go out, we meet at the mailbox. Okay? We both go to the corner, someplace, have a spot that everybody agrees upon. I think that's really my presentation for you. I would take any questions.
Do we have any questions? Do we have any questions out there?
There's a question.
Okay.
Yes,
If you have smoke detectors that are hardwired,
yes.
do they also have batteries, or are they just electric and good forever?
So it's a good question, and it's there's no one answer. Most of them will have batteries as a backup. Okay, so just to define that, so the woman asked about hardwired smoke detectors. Hardwired means it's in the ceiling and no, not that. And it's running off electricity, which is great. And we come into those a lot of time. If you live in a place that's built in the last 5 years, all of them have to have that by code.
Mm-hmm. Yep.
And they'll have a battery backup, which be if electricity goes out, the battery will still have the smoke detector working in case, God forbid, you have two things bad happen at the same time. So you do have to keep changing the battery on that if it has a backup. But it will beep. It will beep. Yeah. Yes.
They also have an expiration date on them. On the hardwired installed fire detectors have an expiration date on them.
Some.
So you better know what it is before you put it up or have it put up.
Yeah. So most hardwired fire detectors have a very long life.
Mine had 10 years.
Yeah.
I change them every 10 years.
So let's go back to the 10-year thing. So the smoke detector that we give out actually has that battery problem solved. This is a 10-year lithium battery. You never change the battery in this.
Wow,
When this thing dies, you replace the whole unit. Okay? So that's a big advantage, not having to go climbing up on ladders and changing batteries.
Do we have any more questions from the audience? If not, we're going to thank him
Thank you.
very, very
Thank you
much.
very
Thank
much.
you.
I just want to do this too.
Some of our board members here have a few things to discuss. We each have a different project to look into or different responsibilities on the board. So, Darrell, if you
Okay, I just want to add, if you want them to come to your house, fill out that sign-up sheet in the packet that you have. Okay. Please sign up. Yes, I wanted to mention again the ARPS safety driver course that's being held at Mount Kisco Hotel. The dates are April 6th, May 4, June 8th. And if you're interested and want to go, the phone number, if everybody's ready, 914-241-2600. And that's at the Mount Kisco Hotel. You will save 10% on your insurance. I know we have taken the course, and we save $10.50 per month. That's nothing to sneeze at in this day and age, for me at least, in this economy.
Thank you. I also met with the library staff, and on the back table, you will see it's a double-sided. This is the calendar, and these are different workshops. The library, the J.C. Hart Library, I don't know if you've all been there or who's been there, is a fabulous, fabulous place. It's unbelievable. They have whatever you want to read about, whatever you want to do, they'll help you. The help is wonderful. The calendar that they give out, this one is for March, gives you all of the different activities that are going on there. Mm-hmm. And a lot of people, I know it's in the paper. I don't know if you people read it in the paper, but I thought it would be a good idea to have the calendar here. You could put it on your fridge or wherever, and whenever you have an hour or so that's free and you want to do something, there's always something to do. Do you have anything?
Yep. On the back table also, you'll note this flyer. Senator Harcum and Assembly members Chris Burdick, Dana Levenberg, and Max Slater, in partnership with the Public Utility Law Project, are sponsoring a Know Your Public Utility Rights webinar, which will be March 18th from 6 until 7:30 p.m. Registration is required. There is a Zoom link on the flyer. An easy way to do it is there's this QR code. You don't need an app. You take your camera right there, scan the QR code, and it will take you to the New York State Senate, Mr. Harcum's Senate site, and you'll get the Zoom link. So that's a good thing. There's been a lot of questions about the utilities lately. And if anybody can't go there and would like a utilities consumer flyer, I do have a few of those with me.
Good.
Okay.
Yes, as the supervisor indicated before, our Parks and Recreation booklet has been in the mail. If you didn't receive it in the mail, it's out in the lobby. A lot of programs and events that are throughout the spring and summer.
Make a
Thank you.
comment about the library.
I did.
Oh, okay.
And please note, as it says on the agenda, that the next meeting will not be the third Friday as we normally have, just like this month. It will be Friday, April 11th.
But I'm sure the staff out there will be there to help you fill out those applications if you'd like. And if you don't, I'm sure there's a way of sending them in. They'll help you with that. Again, I want to thank the New York Presbyterian Hudson Valley Hospital for supplying our lunch today. And have a very good St. Patrick's Day. Be very careful.
Jenny.
And
Supervisor.
absolutely. Did you want to say something?
No, that's yours.
I just wanted to mention something about the library because I only found out about it recently. The library does exhibits. So, if we have any artists in the room, anyone who who collects anything. So I'll give my shameless plug, which is not that I make anything, but I'm displaying a lot of my autograph collection. Probably about a third of it. I have about 150 autographed baseballs, a bunch of memorabilia and things in there. You'll even see a little display of Mickey, Willie, and the Duke, 3 balls there. We have a Larson Yogi perfect ball, 78 World Series team, a lot of really cool things. And but they look for that. They had a World War II display that Paul Martin, one of our local historians, put on. They do art displays in their community room. So if anyone's interested, please reach out to the library, especially if it's your hobby and some of your passions. You could really get in there. Susan, you could put all your knitting in there that you've done over the years. There you go. Well, you put them in the box. But no, it's some really great stuff. And if it's something that you're passionate about, that as you mentioned, there's so many great things going on in the library. But even those that might not be a program, but a way for you to showcase some things. So please take advantage.
And they're very friendly. It's a very warm atmosphere.
Absolutely.
They're happy to have people come in.
Yeah. And they have the new study rooms too.
Yep.
They have little portable hotspots for internet. If you have your computer and want to get online and do some of these things, they have computers available as well. So getting on and signing on for Senator Harcum and Assemblyman Slater's seminars, you could do that. So some great things. Please take advantage. We're one of the busiest libraries in the county, so it's really a great thing. Please take advantage.
Okay,
Thank you.
Thank you. And remember, we'll see you on April the 11th. Okay? April the 11th. We're a week early, and we'll look forward to seeing you. Thank you very much.
Thank you.
Enjoy your weekend.